is just kind of a balancing number. It would have to be in here, because he has a separate salary.
You ready?
Well, yeah.
Sorry. Yes, ma'am. Let's go.
Good morning. My
Good
name is
morning.
Dr. Jennifer Davis. I'm the Vice Chair of the Vallejo Board of Directors, and it's a pleasure to join you this morning. Community mental health centers are more than just another group of providers. They are the county's delegated authority to manage mental health care. Because community mental health centers are required to provide services to all Kansans needing them, regardless of their ability to pay, this makes the CMHC system mission the crucial safety net for Kansans with mental health needs. Vallejo Family Services and Guidance Center and Breakthrough House provide mental health services that promote public safety through work with the corrections and CIT, the law enforcement crisis intervention teams. We promote community wellness by providing coordinated and integrated care between behavioral health and primary care providers. Family Service and Guidance Center and Vallejo are also working with other healthcare organizations such as the Shawnee County Health Center, Marion Clinic, Stormontvale Healthcare, St. Francis, and Health Access to address the primary care safety net needs of our community. From a combined economic impact view, Family Service and Guidance Center, Vallejo, and Breakthrough House provide 643 jobs and contribute $36 million to the Shawnee County economy, of which $1,526,512 comes from county support. With our specialized facilities, we draw people to Topeka for their health care. So I'm going to move now to some agency-specific information and discuss some of Vallejo's accomplishments in 2013. On January 24th, we began participating in a project with the Topeka Police Department, piloting a crisis response unit during 1 shift per week and then expanding to 2 shifts per week in April. Excuse me. We transitioned and implemented open access in intake services and same-day access in medical services in March of 2013, thus reducing the no-show rate from 41% to 4% within the first 3 weeks of implementation. In March, we relocated stepping stones to 330 Oakley in order to consolidate, reduce expenses, and increase opportunity to provide reintegration services to women. We moved and expanded expressive therapies, which includes art therapy, into a larger space, which was completed in May. We held our groundbreaking ceremony in October for the new crisis center at 300 Southwest Oakley. Construction began and completion is scheduled for late September or early October of this year. Fidelity was maintained in all evidence-based practices, with all teams being certified. In November, we developed and explored resources to add a mental health court in Shawnee County by meeting with the municipal court judge, the city prosecutors, and probation officers. We continue to integrate and expand our peer support with all evidence-based practice programs. Peer support was also added to the grant with Kansas Department of Corrections, which approved a half-time peer specialist position. We've conducted educational presentations to community members on mental health and substance abuse issues, resulting in 15,483 individuals learning about Vallejo programs and services. Vallejo Behavioral Health Care is nationally accredited for all programs by CARF, the Commission on the Accreditation of Rehabilitation Facilities, an accreditation we seek voluntarily in order that our organization be held to this higher standard. Vallejo is the only mental health center in the state of Kansas to hold this national accreditation, and we have just recently been reaccredited for 3 years. Vallejo has very positive relationships with key community organizations, including the Department of Corrections and the Topeka Rescue Mission. We also partner with law enforcement, NAMI, and other community agencies with the goal of assisting those we serve to live not only independently, but as a contributing member of our community and to society as a whole. Now I would like to introduce Steve Kearney, the board chair of Family Service and Guidance Center. Steve?
Thank you. Commissioners, good morning.
Good morning.
Thank you for taking the time to hear from us today. I'm Steve Kearney, and I serve as the board chair for Family Service and Guidance Center this year. And I'll tell you that some of you that know me, Kevin and Shelley particularly, that Kelly and I have 2 adopted children, both of which have received services over the years from Family Service and Guidance Center, and really gave me an interest in the good work that they do. And ultimately, over the term of years, resulted in my serving on the board and now as board chair, just to give you a little context, I guess, about what our interest has been. So, since the last time someone briefed you all about Family Service and Guidance Center, about a year ago, I suspect, in this process, I just wanted to give you a few thoughts about what's taken place. So, in 2013, FSGC served over 5,200 children in active treatment and provided education to 9,000. So almost 1 in every 5 kids in Shawnee County has received some sort of services from FSGC. Last year we provided 240,000 hours of clinical service to then really some of our community's most vulnerable citizens. FSGC, as you heard from Vallejo, they do adults, we do children and families, and focus in that area. So not only what have we been doing, what are we doing, what are we developing, what are we thinking about, and here's a few of those things for you all to know. So the Transition Aged Youth Program focuses on the needs of those kids that are moving kind of away from us and maybe over to Vallejo or moving into some other services at 16 to 22-year-old band. So we've begun a program and work a program that's maintained program fidelity through KU, School of Social Welfare, and it's kind of grown to be a regional resource to help those kids transition into adulthood and through that kind of difficult time frame. And we started a family supporting recovery program to help families whose child or children are going through substance abuse treatment, which, as you all know, is an unfortunate kind of epidemic that we have with kids with substance abuse. One of the things that's in process is, in partnership with KU, we're developing an integrated dual diagnosis treatment, the first program for integrated dual diagnosis, adolescent program for integrated dual diagnosis, and that's kind of in development stages currently. We were one of 20 mental health centers in the nation selected to participate in a national trauma-informed learning community, and we will have, as a result of that, a specialized trauma treatment team for children and families out of Family Service and Guidance Center. We just know, as you guys probably heard and saw, we just opened and had ribbon cutting at our new crisis resolution program facility. That's a program that provides for 24/7 up to 72 hours of crisis resolution for our young people that the police can utilize. We doubled our bed space there and moved into a facility that's actually designed for that purpose versus one that was kind of retrofitted for crisis resolution. You already heard a little bit about, in conjunction with Vallejo, that we provided mental health first aid training. That includes all the Shawnee County, just in terms of intergovernmental efficiency, if you will. All the Shawnee County Health Center staff were trained, and we're also participating in the training of law enforcement officers for the CIT, the Crisis Intervention Team training. We also, in terms of community outreach, we added a new outreach and integrated care team where outreach therapists go to the Mission, to Antioch Family Life Center, to Pine Ridge Prep, High Crest Neighborhood Empowerment, in transition and other schools, so that therapists are actually getting out into the community and having that type of an outreach in terms of getting integrated team care out further. We're also an active participant, you'll probably hear more about this in a bit, in Shawnee County's Juvenile Detention Alternatives Initiative. One of the things that, although it's had a little movement here in the last 24 hours, as we were moving towards health home services, that's one of the pieces that we're very interested in, and by July 1st we'll have formalized health home services for some of the population that comes to our center. In some cases, we're the only healthcare facility that any of these folks see. So to be able to be a health home and help coordinate their care and get them out to primary care physicians or other specialists and the like, I think will be a real important service to the community here. One of the things that we always want to assure you about is that we're not just sitting on our laurels and counting on government funding to take care of us, that we have a foundation that continues to move towards its goals and that pays for some of these positions, these additional ones that we're putting in place with these programs. I'd remind you that, and maybe ask you to mark your calendars, August 22nd. August 22nd is our Works of Heart event, one of our bigger fundraisers at the Capitol Plaza Hotel, and it's a very fun deal where the kids have done different works of art from all ages, and those get auctioned off. And it's always very successful. It's a fun evening. You guys ought to make an effort to come if you can. So, kind of in summary then, really the funding from Shawnee County really focuses in four main areas for us. It's access, it's medical services, crisis services, and kind of these emerging community needs that we're always constantly trying to meet and be innovative with. So one of those things, of course, is even though we seek funding from a whole variety of sources, for those folks that can't afford services, the county's funding is very beneficial to us to be able to provide services to them. It's also really important for us because we have a really, really high quality child psychiatry staff over there. So to maintain high quality child psychiatrists here in Shawnee County at FSGC that are really second to none, it plays a very important role in that. And then a critical element of our services, is crisis services. With all the kids we serve in that program, also plays a very, very important role in that. So the last thing I want to say, I guess, is, and I know you all are aware of kind of what's gone on with the state budget and how funds have been cut there, and particularly to mental health services. Over about the last decade, really, it's kind of come down. And we also know that you all have been operating very tight budget times, so we're trying to be sensitive to that, excuse me, in our request to you by holding our funds at, in our request at last year's levels. So be happy to answer any questions, and if you don't have any, I'd like to introduce the next speaker.
I have a quick question, Steve.
Sure.
You said that you had about 9,000 customers last year, if I recall.
Well, we provided outreach too. So we had, let me back up on my notes here, Commissioner.
Okay.
We served 5,200 children in active treatment and provided education outreach to nearly 9,000 children.
And how's that trended over the past 5 to 10 years?
It's trending up. I think, and certainly Brenda's here, and Chris, other folks that could answer that, but that's the other part of, like, with our crisis resolution program. I mean, it's really been moving up in terms of the number of children we serve that are in crisis and that kind of outreach. So putting together putting both the crisis outreach program or the crisis resolution program and then our outreach that we've been doing over the course of this last year or so is bringing our services out to more and more kids. But we've seen in those areas that we can measure over time, we've seen a consistent uptick and uptrend in the number of kids. And I think that's just reflective of the difficulty we're having in our culture and society right now.
Well, I was going to ask you why. I mean, our population hadn't changed much.
Right.
But we're seeing dramatic increases in the customers we have for mental health services. And, that's...
Right.
I always ask why. Why do things happen like that?
And once again, that's just kind of my speculation. I wish I could tell you exactly. I think over time, as state mental health services and state assistance has come down with the closure of the state hospitals however long ago, with all of that, with Menninger's moving, all of those components I think tend to play into kind of the extra stress then that comes on to the local community mental health centers like us in Vallejo, and then just the kind of socioeconomic trouble people are having. It's probably, if you talk to law enforcement guys, they'll tell you there's domestic disputes are up, et cetera, et cetera.
Well, and that makes sense.
Yeah.
That makes sense. So a drug increase, I would imagine we're seeing that.
Right.
I would imagine we're seeing needs that were unmet in the past. And then, like you say, there's been a a lot of downward and outward push, so.
Right,
Okay.
right. So unfortunately, there
Question?
hasn't, yes.
Yes, Commissioner Cook.
Commissioner, I'd probably add, there's more diagnosis, better diagnosis.
Right.
More openness to treatment.
Mhm.
And that's really, I would think that it's been more of a trend that I have personally seen with working with children. There was a lot of a stigma, starting back with, I started in the late 90s. There was still a lot of stigma about taking your child to a psychologist. That was a taboo thing to do. As you see more people being willing to accept services, wraparound services, hopefully we will see a generation that we can head off some mental health needs as they become adults. But it starts with investment in the children, and I think that's
Right.
something you mentioned earlier with Department of Corrections.
Mhm.
But I do have a question
That's
for
a-
Mr. Carney.
Yeah, it's a great observation, Commissioner, yes.
I don't want to take away from Danette, because I know that she's going to make a statement as well.
It's like, no,
Somebody from Breakthrough House.
No, go
wants
ahead,
to-
go ahead. Actually, Robert's going to, but yeah, that's it.
But what has been the impact from the cuts from 2014? Yeah,
You mean your cuts to us?
our cuts.
Yeah.
I can speak on behalf of Malaya.
If you wouldn't mind coming to the microphone.
Sure.
Because this is, we should probably warn, this is being live broadcasted and
Sure.
recorded, so that if people want to look at it later on.
Okay.
But again, the question is, what has been the impact from the cuts from the 2014 budget?
Okay. My name's Glee Ashley. I'm CEO for Vallejo. What we've noticed with the cuts we've received, whether it's from the county or the others, right now Vallejo's sitting at a deficit budget, which is the first deficit bottom line, which is the first time I've seen that in years since I've been at Vallejo. But it's just, with all the changes combined, it's just hard to kind of get that turned around. And we've noticed that our self-pay or our indigent population has increased. I'm saying maybe, I don't have the percent right off the top of my head, but I'm guessing maybe about 8%. So between all the cuts that we've experienced and the way we've had to kind of we're not able to open it up and give as many services that we have in the past because of that. We've had to cut back on certain programs that would help to keep the individual stabilized. It's just like a revolving door. So that's part of the cuts. Our substance abuse services, they have just been getting hit right and left, and part of the money we get from you all, we funnel to them. They just got hit with another cut the other day. So our waiting list on the substance abuse services is about 6 weeks out. I mean, it's awful. So if those type of things, you put them all together, you have to trim down your programs, and you have to figure out how to provide these services, but we're still in a deficit budget even doing all that, and we're going to have to figure out how to turn that around. So we'll probably have to cap off more services to do that.
And the reason why I ask, and just in all candor,
Sure.
is that was one of the reasons why, the primary reason why I was the dissenting vote on the budget,
Okay.
was just my fear and what the impact would be.
Mm-hmm.
And if the impact, this would be a point, if there was minimal impact or no
Mhm.
impact, then my fears were not there.
No.
But if there was an impact, what was the impact? And I think that as we look forward,
Mhm.
is that funding that should be restored,
Mhm.
increased, is flat the right amount? Should it be higher, should it be lower? And if the Vallejo Family Service and Guidance and Breakthrough House were able to operate on less, a $500,000 cut, can another $500,000 cut be made?
It's going to hurt the community a lot, I can guarantee, because it's hurting us right now. It truly is with the
Or,
deficit.
in the alternative,
Mhm.
an increase of 500,000 to what the 2013 amount was. And again, that's really the whole purpose of the budget hearings, in my opinion.
Sure.
Is to have that discussion about what do we do? What's the impact of our decisions?
Right. Well, there's a lot of people out there that need more services than what any of us can provide. So we're just doing the best we can at this
Well,
point.
And I think that's an interesting point, and that's why we're having these
Sure.
hearings, to set our priorities,
Right. I appreciate
because we
that.
have scarce
I
resources.
absolutely appreciate
And
that.
one of the things, too, is that the more we increase property taxes on people, the
Right.
more stress
You bet.
that they have
You
in
bet.
losing their proproperty.
Right.
So that's another balancing
Mhm.
thing that we have to consider also.
I respect that. I know you
Okay.
have to juggle what you're doing just like we do too, and we don't want to see anyone fall through the cracks if we can possibly help it.
Exactly.
So we're going to make sure they get something. It just may not be as much as they need and as quick as they need it, so.
Commissioner Bueller.
Question. Leah, you experienced cuts from the state, the county, and the city, correct?
Let's see.
Last year?
We got a cut from the federal block grant. Did we get a cut from the state? I don't remember state. I know we did the city and the county. We got, on the substance abuse side, we did,
Allocations.
yeah, last year on the county here. So, yeah, we've been getting hit pretty bad on those. And we have had more of our state cuts have come on the substance abuse side, because we just got hit with another one here a
Right.
couple weeks ago, so.
Up until last year, though, we had not reduced, I think, our allocation to you for some time.
No. No, you had not. Not that I remember.
Yeah, and I guess,
I mean, it's been held level.
it has been held level, and
Correct,
I guess, just to make sure I'm clear, I did not second those motions for any of the cuts to social service or to mental health.
Okay.
Did not second them.
Okay.
But I did vote for the budget as a whole.
No, I understand that.
And so I'm just
Sure.
gonna clarify that.
I appreciate that. No, I know you
I-
don't.
Okay.
I think it would be
I appreciate
Make
that.
sure.
more productive to save those discussions for when we're finalizing our budget,
But
and now to get more information and ask specific questions.
I completely agree, but
Okay.
I do want to make sure the record is straight.
No, and I,
Yeah.
and I don't.
And so-
Appreciate that.
Okay.
And
Okay.
I'm just trying, and again, commissioners,
Yeah.
mine is really more, what's been the impact?
Yeah.
And
Yeah.
should we restore?
Yeah.
And that's really where
Good
I hope that we
questions.
focus.
Good questions.
see you restored. A lot of people.
That's for the record, I'm sure, yes.
That's where I thought you were going, Commissioner.
We can't make promises we can't keep,
No,
sir.
absolutely.
I think that's important to remember.
So if there aren't any other questions from me, I'd
No.
like to introduce Robert Sanders with the President of Breakthrough.
Okay, thank you, Steve.
You're welcome.
Thank you.
Good morning, Commissioners. My name is Robert Sanders, President of Breakthrough House, our Board of Directors. Thank you for this opportunity to present information to you again this year, and thank you for the many years of financial support you provided to Breakthrough House. Thank you to Commissioner Cook, in particular, for working with us on funding ideas and issues and for attending our events this year. We appreciate that you are invested in what we do and come out to support us. The county funds have helped thousands of persons with severe and persistent mental illness to live safely in our community. Breakthrough House could not have provided services to 548 persons with severe and persistent mentally ill during 2013 without the meal levy funds. Also, 109 of those served, or 22% of our clients, were veterans. In our residential program, almost 40% of those served were veterans. We continue to have a strong relationship with the VA and have noticed that veterans themselves have begun to refer more and more of their fellow veterans to Breakthrough House. Our staff continues to receive training and learn about the special needs of veterans as the percentage of them have increased of our client base. Just a few things about our goals in 2014. As you know, the Clubhouse provides a safe place for social relationship building, vocational training, support groups, and meals for our clients. Though we had to close 1 day per week beginning in January, the number of our clients and our average daily clients remains at about 44, steady at about 44. We project that we will serve about 350 clients during 2014. Also, as we continue to obtain more information about each of our clients, we estimate that about 60% of our Clubhouse clients have a tri-diagnosis, and this means that not only are they severely and persistently mentally ill, but they also have a substance abuse diagnosis and also a developmentally and intellectual disability as well. We have focused our staff training on all three diagnoses, and we have found our way of individualizing services for each client based on which of their diagnosis is most challenging to them. Another special highlight is that our Clubhouse has grown from 4% of them maintaining employment in 2010 to 21% of them maintaining employment in 2013. And we consider this to be quite amazing, especially considering the challenges that some of our clients do face. As we stated, your funding is critical to us in being able to teach and develop the soft skills in addition to the skills taught in the 5 work units and which help them obtain and maintain employment. The residential program served 43 clients during 2013 by providing housing, meals, transportation, and also by the support of a master's level social work who is also our health and wellness coordinator. She teaches our clients activities for daily living and also which helps assist them as well. We have 36 beds located in 24-hour supported group home, semi-independent living apartments, and independent living apartments. We also currently lease 2 group homes to Vallejo, and this partnership has worked out extremely well in filling the gap for our clients who have become recently homeless or have no income. Your support is so important to these citizens. They simply wouldn't have no place to go otherwise. The trend discussed in our application with twice as many of our clients entering jails and the mental health hospitals this past year has continued. We're still successful with between 88 and 90% outcome of our clients not entering jails or the mental health hospitals. However, this has declined. Previously, we were about 95% or higher in retaining them from those facilities. You've heard, I don't know if you've heard, but you may hear from Brian Cole this morning, so you know that this is not a surprise. We described the payee program in our application, and since it does not receive funding from the meal levy, I won't discuss it here this morning. I know you all know the good work accomplished with that program. The funding that the county provides is critical to those in the community through no fault of their own are impacted by having a severe mental illness. On their behalf, thank you. The top priority of our board of directors this year continues to be diversifying our funding and increasing our funding base. We set a 5-year goal of developing a reserve so that we are here to meet the needs of those with severely and persistently mental illness in the future. We are becoming increasingly successful in raising private dollars and expect to continue to do that. Since January of this year, we have obtained new grants totaling about $8,300, and funders have chosen our beneficiaries for the fundraising, even bringing that total to another $7,500 above that. Also recently, we have been asked, as by invitation only, for Breakthrough House to apply for another grant that averages $45,000. So we're hopeful to receive this funding during 2014. Thank you, and if you have any questions, I'd be glad to attempt to answer those.
Thank you. Questions, commissioners? Commissioner Buick?
How's the new clubhouse doing over on Topeka Boulevard?
It's going very well. Yes. Annette?
For the ribbon cutting, the offices over there?
Yeah.
It's going really, really well. We've noticed by moving from the castle building that it's helped, what we hoped it would help was reduce some of the tension over there when we deal with people's money. So we have a better lobby. They can use the restroom freely and that kind of thing. So it's going well. We're crammed in there quite a bit. It's okay.
Commissioner, if I have a question maybe just for Betty. When we look at this allocation for Vallejo, Family Service and Guidance, and Breakthrough House, is it 3 separate lines on our budget, or is it 1?
No, it's 1.
And how does that get divided out? Is it get divided out by percentages? Is it up to Vallejo, Family Service and Guidance, and Breakthrough House to fight it out?
Well, CRC is our as I understand it, is there someone here from CRC?
On this one, I don't think it is.
There is not?
I don't think
Okay, as long
CRC
as-
is a
Don't we
administrator
have-
of this.
They're not?
No, I don't think so. Not on this one.
Okay, I'm sorry, see, I'm not the right person to ask, I guess.
It looks like it's all together on.
It looks like, yeah, it's all together on one line. You know, I would have to double check and
Okay.
see unless,
Yeah, I can speak a little more about that too.
Yeah,
Brenda can
sure.
talk about more than me because I am.
no, I'm glad you did, because I thought this one went through them too, so.
I'm not quite sure how they came up, because again, this was before my time on the allocation, because we allocate the mill levy, and what we do is if we get increase or decrease, it all goes back on the same percent they're currently getting, and I'd have to get those percentages breakdown. I have the dollar breakdowns, but I don't have the percentage breakdown. But also, that's why we do it with all of our funding, because we also allocate some back to Breakthrough that we get through the block grant and also to the state aid. And I know in the beginning, the reason we were doing that was because, this is what I've been told anyway, was because they provided services that we didn't provide, and such as family service does the children, and I know Breakthrough is doing something that Vallejo didn't provide. We've continued on that tradition of making sure they got those other two allocations too, so.
I can't speak for
Okay.
but it would be helpful for me if I had some background
Okay.
as to how that came about or
Okay.
what the breakdown is.
I can sure get you the breakdown, the background, and that's, like I said, I've been with Vallejo 20 years, and I don't know. Do you know how the
Well,
back?
and is
breakdown
it
came about?
specified in the contract too, when we do our contract with Vallejo? I'm not sure.
Is it
but
specified how much goes back to each one?
I don't
think that
know.
does.
It's not
Yeah,
in the
I don't think that
contract.
does. I've not ever seen that. But
Okay.
I know the proposal we turn into you all, it has the breakdown there. And I've got the proposal here. If you want to see that, I
Yeah.
can sure show it to
Yeah,
you.
the proposal
Yeah,
has
it
that.
has the breakdown here, yeah.
But it does have, do you have that breakdown too? Okay, so we have that breakdown. But how that first got started, I
It-
read it.
I think that it would be helpful, I think, at least for me, when I'm
Okay.
looking at, there are 3 different, very distinct communities that are being addressed
Right.
by Vallejo, Family Service and Guidance, and Breakthrough House.
Uh-huh.
And maybe not this year, maybe not next year, but maybe at some point, the county commission wants to make a huge investment into children or Breakthrough House. And how that is done, I think, would be helpful, because
Okay.
when we look at that allocation, we're looking at that allocation as a global allocation.
Okay.
Yeah, we'll do
Yeah.
that.
Okay. I don't know, Brenda, if you want to say anything about how that started, I don't know that to you.
Brenda Mills, CEO of Family Service and Guidance Center, and I have been around since 1989. So I know this, and this was actually crafted with the previous CEO before my time, but I was involved in it. Long ago, when Vallejo was Shawnee Community Mental Health Center, there was an allocation that went to Shawnee Community Mental Health Center, and there weren't other parties involved in this presentation. There was a very small amount that went to Family Service and Guidance Center, and I don't know if there was money that went to Breakthrough House at that time. Through a partnership with the commission and the centers at that time, looking at trying to find a way to fund appropriately in proportion funding for children and adults, they laid out like a 5-year plan to try to get to, and I think the number is at least a quarter of the money goes for children, trying to look at the population of the community so that it matched up with, if there was 25% of our population were under the age of 18, that's what they were trying to accomplish. I can't speak to how it was set up with Breakthrough House, other than, as Aglia said, they were doing some work for Vallejo, Shawnee Community Mental Health Center at that time. So we started out there were incremental increases for Shawnee Community Mental Health Center at that time, but also a bigger proportional increase for Family Service and Guidance Center to get to that point. We never got to the 5th year of that plan because the economy started tanking, and we had to keep things level for several years. Then we had a reduction one year, and then we kept it level, and then we had the big reduction last year. So that's how it came about. It was a planned event over a period of time. I think when the economy was better and the commission could kind of foresee for the future that we needed to put this additional investment into children. Across the state, the investment from the counties goes to a community mental health center. We just have this unique setup in
Right.
Shawnee County where we've
Right.
got 2. So that's, and at that time, the entity that was getting the funds felt it was important to bring the other parties in here so you guys could have an opportunity to ask specifics. And as far as
Right.
how you could decide to allocate, that's up to you. But we appreciate being able to be involved in the process, because 20 years ago, we weren't, so.
And again, the reason why I ask is there may be a time in the future where Shawnee County Commission wants to make an initiative for a specific population.
Right.
And if we were looking at a budget increase, we want to say, we want to keep 1 or 2 the same, but we really want to increase. And I don't know that we have that mechanism now, where it just says Vallejo.
Right. And that's kind of how it came about before. There was an effort, and it only just showed up in our papers, but it still always showed up as the one-line allocation, but there was an
Right.
agreement between, and I actually think I have a document that agreed to that. I mean, it was, I
Yeah,
actually think there is
there
something.
is something.
But I
Yes.
think
Yeah.
Commissioner Cook's thought was that, things change.
Sure, sure.
And, just doing things the way we've always
Right.
done
I'm
them
just
may
providing-
need to have a
yeah.
look at.
I'm
I
just
think,
providing the
so.
historical context, so
Yeah.
you know how it came to be to begin with.
Okay,
Yeah.
all right, thank you. Anything else? Commissioner Buell?
This is my maiden voyage in this process. So
Welcome
did you
aboard.
have any, thank you. Did you have any questions for me, or did Glia answer your questions about Vallejo?
I think we're good.
I
Do you
think
have
I'm good.
anything else,
No.
Commissioner?
Okay,
Commissioner Bueller?
very good, thank you.
Okay, thank you so much.
Let me finish up by saying that over the past several years, we've experienced significant changes, as you've heard, in both the local and state mental health environments. These changes continue to place additional barriers in providing services. There continues to be an increasing number of individuals unable to pay for services, and we must acknowledge this increase and be able to staff to meet this demand. We are respectfully requesting a level budget of $1,526,512 for fiscal year 2015, composing 4.3% of our collective budgets. I would like to thank you so much for your ongoing support of these valuable community services and for your consideration of our request. Thank you.
Thank you.
Thank you very much. Thank you all. Just a reminder that this afternoon, at 1 o'clock, we have a hearing for the county clerk.